Welcome to this video on anatomical terminology, focusing on the planes and axes of the human body. This is a fundamental topic, crucial for anatomy, radiology, and biomechanics. While direct definitions are rare, the application of these concepts silently appears in many clinical questions. Our learning objectives are to clearly define anatomical planes and axes, identify them on diagrams and imaging, apply this knowledge to describe movements, and confidently answer USMLE-style questions. If you master these 4 points, anatomy will become much easier. Understanding planes and axes is vital for radiology, as it helps interpret CT and MRI slices and localized lesions. In clinical practice, they are crucial for describing surgical approaches and joint movements. For USMLE testing, this knowledge is often assumed when interpreting clinical vignettes. All anatomical descriptions are defined with respect to the anatomical position, regardless of the patient's actual posture. This position involves standing upright, facing forward, with upper limbs by the side, palms facing forward, and feet pointing forward. Descriptions are not based on patient posture. An anatomical plane is an imaginary flat surface used to divide the body into sections, describe structure locations, and interpret imaging. The 3 principal planes are sagittal, coronal, and transverse. Every scan you see will belong to one of these 3. The sagittal plane runs antero-posteriorly, dividing the body into right and left parts. Subtypes include the median or mid-sagittal plane, which creates equal halves, and the parasagittal plane, which creates unequal halves. Midline brain structures are best seen in the mid-sagittal plane. Movements associated with the sagittal plane include flexion and extension, such as walking or nodding your head yes. These movements occur around a transverse axis. Clinically, this plane is used for visualizing herniated discs and evaluating spinal curvature. The coronal or frontal plane runs side to side, dividing the body into anterior front and posterior back parts. Common applications include chest imaging and facial anatomy assessments. Many sinus CT images use this coronal view. Movements associated with the coronal plane are abduction and adduction, like performing a jumping jack. These movements occur around an antero-posterior axis. Clinical uses include standard paranasal sinus CTs and localizing facial nerve lesions. The transverse or horizontal plane runs horizontally, dividing the body into superior upper and inferior lower parts. This is the most important plane for radiology, as standard CT scans are acquired and initially viewed as axial slices. The movement associated with the transverse plane is rotation, such as shaking your head no or twisting your trunk. This movement occurs around a vertical axis. Clinically, it's used for CT brain to localize strokes and determining spinal cord injury levels. To summarize the anatomical planes, sagittal is antero-posterior and divides into right and left, allowing flexion/extension. Coronal is side to side and divides into anterior and posterior, allowing abduction/adduction. Transverse is horizontal and divides into superior and inferior, allowing rotation. Now let's discuss anatomical axes, which are the imaginary lines serving as pivot points for movement. The key rule is that a plane and its associated axis must be perpendicular to each other. We have 3 types of axes. The transverse axis runs left to right and is perpendicular to the sagittal plane. The antero-posterior axis runs front to back and is perpendicular to the coronal plane. The vertical axis runs up and down and is perpendicular to the transverse plane. The transverse axis runs left to right, acting like a hinge pin. It is perpendicular to the sagittal plane and facilitates movements of flexion and extension. The antero-posterior axis runs front to back, perpendicular to the coronal plane. It governs movements of abduction, moving away from the midline, and adduction, moving toward the midline. The vertical or longitudinal axis runs up and down through the center of the body. It is perpendicular to the transverse plane and allows for movements like rotation, pronation, and supination, such as shaking your head no. This table is high yield for exams. Remember, flexion and extension occur in the sagittal plane around a transverse axis. Abduction and adduction occur in the coronal plane around an antero-posterior axis. Rotation occurs in the transverse plane around a vertical axis. Here is a USMLE-style question. A radiologist reviews a CT scan dividing the brainstem into superior and inferior portions. Which anatomical plane is this? Since the body is divided into superior and inferior parts, the correct answer is C, transverse. Common mistakes include confusing plane with axis, forgetting to reference the anatomical position, and mixing coronal and sagittal divisions. Always ask, how is the body divided for the plane, and what movement is occurring for the axis? As key takeaways, remember that planes divide the body, and axes allow movement perpendicular to those planes. Radiology relies heavily on planes, while orthopedics uses axes. Mastery of both simplifies the rest of anatomy.